As far as assessments and screening tools go, I think there's a few around that are useful, like the Headspace one, the interview, as well as the usual screening questions. There's a couple that I think are important that we've looked at from data that we've seen in things like suicide registries, etc. That's the kind of issues around whether there's community unrest and whether there's good things or bad things happening in the community at the current time. The same with family. We know that the family is such a huge influence on young people, and we've seen this in recent studies that have been published as well from the longitudinal study of Aboriginal children. One of the things that we find key is recent bereavement and ensuring that young people get some kind of debrief or counselling around that, because usually they miss out. And the other is recent suicide in the cohort group. Looking at pro-social relationships, so that their kind of circle of friends and friends they can confide in. It's really important for any clinicians that are working with young Aboriginal and Torres Strait Islander people to actually have a little bit of an understanding of their context and the epidemiology of not just disease but social issues. So in some states, over 90% of the young people that are Aboriginal have come in contact with the criminal justice system in a very negative way. It's important to know that. It's important to know that they have a lot more adverse childhood events than most people, and they have ongoing stress, which can be measured by stress hormones in their lives. So they've been exposed to a lot by the time they come to see you. Often, if you give them enough time, they'll tell you about those kinds of issues, and it's a matter of them being sensitive to them opening up about that. But what we've found is that the majority of our young people who've gone through adverse childhood experience like exposure to domestic violence, sexual abuse, violence in the household, haven't had any debriefing or any counselling about that. Some have been exposed to seeing suicides and haven't had no counselling or debriefing. So you may be the first point of contact in the health system that's able to help them. It's really important to go back and understand their history and those contextual issues that we see as just the stats but are really meaningful in these young people's lives. One of the important ways of understanding cultural issues is just specifically asking the young person when they come in, what do you think caused this? That gives them the opportunity then to talk about any cultural issues that they may have a belief in that's part of a causation issue that can help you to better support them. So it's really important for us to understand that for the patient, a diagnosis can mean a lot of different things, both positive and negative. For us, it means probably more of a structured approach to how we can work with someone. Aboriginal Islander people often will take a diagnosis and go, yeah, maybe, or they'll go, no, it's because I broke law somewhere. I trust what that person says and that's what they think's happening. There's actually other things happening in my life that have more influence on my illness than what they're talking about. So it's important to keep that kind of open approach.